Fear of deportation is keeping some Arizona residents from seeing a doctor.
But 5 regional health centers are working to change that and find ways to keep people healthier.
Cronkite News reporter Anikka Abbott joins us now.
Anikka, you got a chance to look into one of those programs in Cochise County.
CHEC, a health education center in southeast Arizona, has helped transform the colonia of Winchester Heights by teaching its residents to help one another. It may come as no surprise to you that over 90% of farm worker patients are Hispanic. Overwhelmingly, the top diagnosis for these patients deal with weight-related issues and hypertension. With over 70% of farm workers living below the poverty line, experts say socioeconomic levels and the lack of healthcare access may exacerbate the issue. In Winchester Heights, a handful of people gather in a one-room building reminiscent of a schoolhouse. And in a way, it is. Together, they're learning how to tackle one of the biggest issues in rural areas, access to health care. CHEC, an organization working to bring health services to more people, built the new community center to help the mainly Latino neighborhood, especially local farm workers.
Particularly precarious with farm workers is the type of labor they're involved in, if it's shift work versus ongoing or formal employment. And so some people might have health insurance and health coverage and others may not.
A U.S. Department of Labor survey finds that 53% of farm workers are uninsured. And even if they do have health insurance, the ratio of people to primary care doctors in rural areas is 2,500 to 1.
It's not saying necessarily that we don't have enough health professionals. It's saying that they're not distributed well throughout the country.
Public health expert Jill Guernsey-Dezapian says fear of immigration authorities leads many Latino farm workers to skip seeing a doctor, even if they are legally documented. But there are still more barriers to health care.
But the problem really is more the access to services because of the long hours that people are working.
To reach Latino farm workers, public health students from the University of Arizona trained a team of neighborhood health educators, or promotoras de salud. Promotoras go door to door in this colonia to teach their neighbors about better nutrition, exercise, and even how to protect themselves against skin cancer.
And then she told me, I am so grateful because I didn't know, but now I know that you have to wear a hat.
Most farm workers in the area are employed at Nature Sweet Farms, less than 10 minutes up the road. 400 people work in this tomato plant. The majority of them work here in the greenhouses, and almost 95% of them speak Spanish primarily. Latino farm workers say the community center and promotoras have made an impact on their health.
It would be good to help with work and for the people to learn more.
CHEC coordinator Linda Cifuentes says promotoras may be a good solution to a common rural health problem.
So I see them as pivotal in other communities who are in the same situation where they don't have support from their local governments or local agencies.
CHEC hopes to turn the center fully over to the community next year. CHEC has been training promotoras de salud since 2013 with the help of interns from the University of Arizona, Mel and Enid Zuckerman College of Public Health. Live in the studio, Anikka Abbott, Cronkite News.